thank you so much for spending some time with me today.
Thank you. Thank you for inviting me.
I am excited to have this conversation with you because we are always interested in our clients' experience and how your time was with Thunderbird Leadership Consulting. So we'll dive in just a second. But before we do that, tell us a little bit about sort of who you are and your leadership journey.
Thank you, Rhonda. Well, I am an Arizonan and I am an immigrant. I was born in Mexico, actually, and I love that I get to work in the social service space. I went into social work in my career and then ended up trying to tackle social problems from a macro perspective. And so ended up doing healthcare administration type roles. I led an organization for a long time in a variety of positions, but my last position was as CEO of a behavioral health and primary care organization that operated both in Arizona and New Mexico, a very complex organization. And then my most recent role, I was the head of a state agency in the government space, also trying to impact the communities served through social services, through healthcare, and that was through Medicaid specifically. And so I have that background of healthcare, of increasing access to care and services, and then to doing that with a policy lens and through administration of programs and development of both systems and specific programs or organizations that make that kind of an impact.
Wow, Carmen, what a rich, varied background you have, and it's incredibly impressive to hear the work that you've done and the impact that you've been able to make through your work. Thank you, Carmen. So, from your perspective as both a regulator and a provider, how do leadership practices affect the value-based reimbursement program? So we know that that is big today, and many organizations are looking to understand what they can do to support and improve their reimbursement. So what would you say?
Well, value-based programs all come from the tenets of offering, again, the best value, which is going to be a mix of great outcomes and if we're talking about healthcare, great outcomes in healthcare, so people actually getting healthier.
Mhm.
At the same time, they're happy with their care and they're highly satisfied with it. And you're doing it at a good value and a price point so that the price is affordable and it's affordable care that you could offer. So, an analogy could be that, you could offer the Cadillac, but the Cadillac's going to cost you the Cadillac price, right? The top of the
Mhm.
line. And you could go, or, you could, using the car example, get a very cheap car, but you're going to get, maybe not a lot of years of usage out of that or poor outcomes. And in healthcare, you're trying to get that sweet spot, that mix.
Yes.
And that is so much more difficult to do than it sounds because you're juggling all the pieces at the same time. You're juggling the patient experience and that customer service and the satisfaction that goes with it. And you're collecting that information. You're making sure that everybody on your team has the training and understanding and makes the patient experience first and foremost.
Mhm.
And then that you're providing high quality care with the tools that you have at that price point, right? So it's a lot to juggle all at once. And it takes, I think, very focused leadership, intentional leadership. The decisions that happen, even at the very top, are going to have that trickle down effect of are the staff going to have the right tools and resources to be able to provide the best high quality care at the satisfaction, right? So if that means investing in an EMR product that is an electronic medical record product that is going to make it faster to capture data,
Mhm.
or a technology that's going to capture the diagnostic results more effectively and better and input the data in a way that's efficient so that you're not doing double entry work. All those decision points happen with the leaders that are at the top of organizations that have to think down the line, right? And just be very thoughtful. And then I think it takes training on the usage and implementation of all those tools at the front line, along with that, keep the satisfaction and the patient experience high, right? So I go back to the point that it's a lot to manage. So there's a lot of room to maybe drop a ball, or if you have interpersonal conflicts within your leadership teams, how is that going to play into making sound decisions that all lead to that, AAA that value-based programs look for? So you have to have effective, high-quality leaders with healthy teams that make all those decisions and then have a focused approach to the healthcare team that they're leading, right? And that takes a lot of energy, and people get burnt out, and everybody, definitely, has home runs and makes mistakes along the way. And so you have to provide the space for people to reflect on their approach so that they can constantly make adjustments. And so I think it's very healthy to pair a value-based initiative with leadership coaching and leadership training so that you could manage all the complexity of all those things happening at the same time.
Yeah, well said, Carmen. I think about, let's say I am a busy provider and we have a lot going on, as you just described it. Even this process in and of itself is a lot for us to manage. And I think to myself, listen, we're really busy. We've got our heads down working. We don't have time to do leadership training or leadership development. How would you respond?
I think that that's a great question, how to respond to it, because it's sort of like you don't knock it until you try it kind of a thing. But they don't know, right, what the benefit will be. And I think that I would invite people to look at, is everything perfect and is it working? And if it's not, if the answer is no, it could be better, then why are they frustrated? And if you unpeel that over and over and over, sometimes it'll be a tangible, it's funding, or it's a lack of a resource. But all those things sometimes can be offered with, was there effective advocacy in order to get the funding that you needed? Was there effective advocacy in order to get the resource that you needed? Is the problem solving really happening? Is there competition within a team in a way that is getting, those interpersonal dynamics that are getting in the way of getting the work done? So I think when people take an opportunity to be reflective over what their frustrations are, a lot of times I think the answer is in improving a leadership kind of approach, a solution that, is more about the intangible that can fix then those concrete, tangible things.
Yeah, I love that response, because it is sometimes those intangibles that come into play and make all the difference. It might, on the surface, seem like it's A, but when we start to pull back the covers and do a deeper dive, we find that our leadership can influence those outcomes that we're receiving.
Yep.
Well, you went into the partnership with Thunderbird Leadership having an idea of what your expectation was. After speaking with us and learning more about the work that we do, what one thing did you not expect, but that you experienced in working with Thunderbird?
I think I was, it's not a big thing, but I was really pleasantly surprised with the size of the team of the organization and the readiness of it and availability of everybody. And everybody that you spoke with knew what the project was, what our issues were, and was just very attuned to, I know that Thunderbird had other commitments and other work, but everybody we talked to knew what we were all about and what our needs were. You don't have to re-explain things, right? So it was really a great experience in terms of a pleasant surprise that it was larger than I anticipated Thunderbird to be, well-staffed and well-equipped with lots of people able to help us. And then everybody was really attuned to our needs. And so it was just, we weren't, working with just two people, right? It was a whole team of people that were ready to serve, our organization.
That's fantastic. Thank you. It's a part of our commitment in truly being a partner with our clients. And we know that that's what they expect and that's what they deserve. So, one last question for you. You're in your office doing your work and you get a phone call from another organization and they say, hey, we're thinking about working with Thunderbird Leadership Consulting. What would you say to them?
Well, I would say a lot of what I've said today, but I think what pops into my mind is actually testimony that I heard from someone that recommended Thunderbird to me. And so I heard them, this group transformed our organization. And here's how they helped me. I heard another reference. I had two references from personal feedback that had separate experiences, but amazing outcomes. And one of them said that they signed up for a long-term commitment with Thunderbird, knowing that change takes a lot of time, and they were still working with Thunderbird, and just couldn't speak more highly of the work that's done. And so now relating that to my personal experience, I could validate that the references were speaking truth and that we were seeing some of those same outcomes. And so I think that it is a great investment of both time and resources, and that I think that the teams will always be grateful for the opportunity to work with Thunderbird.
Wonderful. Well, thank you so much, Carmen, for your time. It's been a pleasure chatting with you and hearing your experience today. We look forward to continuing to do some of the work that we're doing now together. Very excited about that. And so I appreciate your time.
Thank you, Rhonda.